Hello classmate, we'll continue chapter number 5, that is circulatory system. Alright, so in the last session we talked about the circulation of blood through human heart. We found the roles of different blood vessels, arteries and veins especially. Then we saw the different chambers of the heart and their function, everything we saw. And today we'll mainly see the pulse, okay, what actually the pulse is, and also the heartbeat, okay, pulse and heartbeat. See, pulse means, you see, is throbbing, which we usually feel there in the arteries below the skin, okay, just below the skin there are the arteries, okay, where we feel throbbing there, especially in the wrist region. When you do like this, that time a kind of throbbing is felt, which is called pulse. All right, so how it is felt is that, and how it is formed there in the arteries is that, let me tell you. See, these arteries have muscular wall, okay, through which the blood flows, okay, through which the blood flows. So when the blood flows through these arteries, that time, this wall of the arteries expand, okay, so that time that throbbing is felt in the arteries just below the skin, which is called pulse. All right, and as you see, this pulse usually is felt in the wrist also. Putting the thumb out here, that kind of throbbing is there, which is felt there in the wrist usually, okay. So then what happens is that then as we discussed in the last session also, that they continuously contract and expand, causing the heartbeat. So how it actually happens is that, let me tell you once. See, yeah, when the contraction of these auricles take place, okay, when these auricles contract, so that time these valves, which you see out here, tricuspid valves and bicuspid valves, okay, which are also called auricular ventricular valves, okay. So these auricular and ventricular valves, they remain closed soon after the contraction of this, they remain closed. All right, then in the meantime, soon after that, that means that closing of these valves is immediately followed by the contraction of the ventricles, okay, contraction of the ventricles, which causes the soon after the contraction of the ventricles, again this your semilunar valves of these two regions, okay, semilunar valves of aorta and semilunar valves of pulmonary artery also remain closed. So that time a kind of sound is produced, which is called heartbeat, which is called what? Heartbeat. Okay, so this heartbeat is usually felt using a kind of instrument called stethoscope. Okay, we use what? Stethoscope. Doctor uses a kind of instrument called stethoscope, which is actually used to hear the sound of heartbeat, okay, there in the chest. So the chest piece, as you see here in the book also, there is the chest piece. So this chest piece is put there in the chest, and the heartbeat is heard or felt usually. That actually this stethoscope is an instrument that amplifies the sound of the heartbeat so that it can be clearly heard. Okay, so this is how this stethoscope is used. All right, and beside this stethoscope, usually what people can also feel is that or how they can feel is that, usually if they don't have this one, normally they can put the thumb here in the wrist region, and there the pulse can be felt out here also using this thumb. So if the pulse rate out is faster, then we find it there is hypertension, okay, because we know that heartbeat usually is 72 times per minute, average 72 times per minute. That's the average heartbeat of a normal person. So when the heartbeat is 70 times per minute, then it is okay, normal. But when it beats more than that, then what it indicates is that a person is having a hypertension. All right, and if it is going below that, if it is very slow, then there is something wrong there in the heart. So this is how the heartbeat is felt, okay, without the use of this stethoscope, or doctor uses this stethoscope, which actually amplifies the heartbeat so that it can be heard clearly using this stethoscope. All right, then we have blood pressure. As you see here, blood pressure is also there. Okay, blood pressure. So before going into blood pressure, let me tell you, though it is not there in your syllabus, but once you go to the higher standard like class 10, then there you need to know about it, which I am going to tell you now only, okay, for your benefit, for your knowledge, that contraction of the heart, okay, contraction of the heart is called systole. Okay, it's called what? Systole, S-Y-S-T-O-L-E, systole, contraction of the heart as a whole. Actually, these auricles contract followed by the contraction of the ventricle, so there is phase, but as a whole, as you see, the contraction of the heart is called systole, and the relaxation of the heart is called diastole, because you know that your heart regularly contracts and relaxes. Okay, so that contraction of the heart is called systole and relaxation of the heart is called diastole. That's why when the blood pressure is measured, there is always two limits, upper limit and lower limit. Normal is 120/80, that all I believe. So what is that actually? What is blood pressure then? Okay, how is that blood pressure caused? What is blood pressure in fact? Let us see blood pressure now. So blood pressure means the is a pressure exerted by the blood when it flows through the artery, or especially aorta. That means when these ventricles contract with heavy force, so that time with that force the blood goes through this aorta and artery. Especially through aorta, it has to go to the different parts of the body. Okay, it has to go to the tip of the fingers there in the leg, also there in the feet also. That far it has to go from your heart, so that it has to contract with great pressure, so that with that force the blood can be transported there. All right, so that time what happens is that the blood flows through this artery with heavy pressure. Okay, the blood actually exerts the pressure on the wall of the artery, or on the wall of the aorta especially. So that force exerted by the blood flowing through this artery or aorta is called blood pressure. It's called what? Blood pressure. So that when it flows from the heart, exerting the pressure on the wall is called higher limit of blood. Okay, that maximum limit. So upper limit, and when the heart is relaxed, that time the blood flows inside, that time the pressure becomes low, so it is minimum. So that always when the blood pressure is measured, so always two limits are given. Okay, so normal is 120/80, which means when it contracts, that time it should be 120. When it relaxes, then that time the pressure should be 80. So 120/80. So this is how the pressure is measured. Okay, these are the blood pressure. Okay, this is the instrument for measuring the blood pressure, sphygmomanometer. Remember, to measure the heartbeat, or usually the heartbeat here, so we have stethoscope, whereas to measure the blood pressure we have sphygmomanometer. Okay, so this is all about your pulse, okay, heartbeat, and the blood pressure. All right, okay. Now we'll see two problems related to your heart. Okay, that means two diseases with in connection with the heart. So they are very much commonly known as cardiac arrest and heart attack. All right, cardiac arrest and heart attack. Okay, so these are the two problems that we find related to the heart, and these two problems are actually not the same problems. The symptoms are different, but commonly people think that these two things are the same, but they are not the same. So the symptoms are different in both the cases. So in this particular case, we'll see the differences between cardiac arrest and heart attack. All right, so first we'll talk about cardiac arrest. Cardiac arrest is a disease or is a problem, okay, related to the heart, where what happens is that heart suddenly stops pumping the blood to different parts of the body. So as you know that heart is the pumping organ, but once the cardiac arrest takes place in a person, what happens is that it stops functioning now. It stops pumping the blood to different parts of the body, okay, and person suddenly loses consciousness, okay, stop breathing or have abnormal breathing, okay, either completely person stops breathing or the rate of breathing goes abnormally high. All right, okay, and if within a minute, if the treatment is not given, okay, immediate treatment is not given, if immediate medical treatment is not given, even it may cause death. Okay, so it's a very fatal disease, or it's a very fatal problem related to the heart. Okay, and it is mainly caused due to the major blood loss. When there is a huge loss of the blood, then the cardiac arrest might take place. Also because of lack of oxygen, when there is less oxygen there in the body, your cardiac arrest may take place. And also because of the low potassium level, when there is low potassium level in the body, that there is a chance of the cardiac arrest. And also because of the heart failure, this cardiac arrest might take place. So these are the reasons why the cardiac arrest takes place in a person. So what is the remedial step of this, or what is the treatment, okay, to be given to a person having this? Immediately, this your CPR, it is called CPR. Okay, CPR means your cardiopulmonary resuscitation. Okay, cardiopulmonary resuscitation. Okay, resuscitation, cardiopulmonary resuscitation is the only treatment to be given to the person who is having this cardiac arrest. Okay, whereas on the other side, as you see, heart attack. What is heart attack? So heart attack is a problem where we can see a sudden interruption of blood supply to the part of the heart, okay, or to the part of the heart, especially the cardiac muscle. The heart is made up of a special type of muscle called cardiac muscle. Okay, what? Cardiac muscle. Okay, this cardiac muscle, let us say this is the heart. So this cardiac, or this your heart, is also made up of cells only. So they also need the supply of oxygenated blood. When these cells, or the cells constituting the cardiac muscles of the heart, if are not getting the oxygenated blood, then what happens that this heart attack can take place. Okay, there is a the vessel called coronary artery. Coronary artery is there. There is a blood vessel which is called coronary artery that supplies the pure blood to the wall of the heart. All right, but because of some reasons, what may even happen is that your coronary artery sometimes gets blocked. Okay, so that time the wall of the heart will not get oxygen, will not get the blood, oxygenated blood. Consequently, this heart attack takes place. Okay, so that time what happens is that chest pain will be there. Okay, chest pain will be there, but still the person having this problem is conscious. Still what? Conscious. He is still breathing normally. All right. Only the problem is the chest pain, but in that case also the immediate treatment needs to be given. Okay, but if the treatment is delayed, okay, if the if the care is not taken up immediately, then what may happen is that the person again might go to the other stage called cardiac arrest. So he might be having the problem called cardiac arrest, and the person might be dying. Okay, but one thing that I have to tell you again is that though the heart attack has taken place in the person, but there the heart is still functioning. The heart is still supplying the blood to the different parts of the body. Okay, so here in this case it stops functioning. It stops supplying the blood to the different parts of the body. But here, though the problem is there, chest pain is there, but still the heart is supplying the blood to the different parts of the body. Okay, it is mainly caused due to the lack of oxygenated blood in the heart muscles, which is called cardiac muscles, where the person is still conscious, is still breathing. Okay, only the chest pain is there. But in both the cases, immediate medical treatment is needed. If it is neglected, if the treatment is not immediately given, so both the cases are very much fatal, and both of these might take the life of the person, also life of the people also. Both are life-threatening problems related to the heart. So today we'll do only this much, and we'll continue in the next session. Okay, so thank you very much.